My question is to the Premier. Hospitals across the province are struggling under the surging second wave, and Ontarians are worried about these pressures are going to mean for their own health care. Hospitals are already trying to catch up from a backlog of surgeries and other procedures created during the first wave. But now, in my region, in the Grand River Hospital has had to pause surgeries this week because their ICU is over capacity, which means even more people are going to be waiting for potentially life-altering health care because of this government's failure to invest in preventing the second wave. They've denied the paid sick days, Mr. Speaker. They've done insufficient contact tracing. They've had a sloppy testing rollout across this province. And so right now, we are at a crisis, another healthcare crisis for hospitals in Ontario. What does the Premier have to say to the families in KW who are now stressed and suffering because of his bad choices?
Minister of Health.
Thank you, Speaker. Well, I have to start by saying that I fundamentally disagree with the assertions made by the member opposite. In fact, we have planned since the beginning of this pandemic to enhance our capacity, to make sure that we have the capacity tracers that we need, to make sure that we can bring forward a response that merits a substantive increase in the cases that we've seen between Wave 1 and Wave 2. Clearly, we've seen that Wave 2 is having a more significant impact on our healthcare system, but we planned for that. And in fact, we have created over 3,100 beds in the province of Ontario since the beginning of March. We've invested $351 million to create more than 2,350 new beds at 57 hospitals and alternate health facilities across the province. We've also invested over $1 billion in testing, tracing, and contact management to make sure that hospitals can continue to do their work to take care of the COVID-19 patients, as well as being able to take care of the surgeries and procedures that were postponed during Wave 1.
A supplementary question.
Thank you, Mr. Speaker. There's a serious disconnect between that answer and the reality that is facing Ontario's hospitals and communities across this province. The net deficit for the Ontario Hospital Association is predicted to be at $500 million. That's including a revenue loss of $320 million. But, Speaker, it's not just the Grand River Hospital that's facing a capacity crisis right now. St. Mary's and Cambridge Memorial Hospital in the region are also close to hitting capacity. And ICU numbers and hospitalizations continue to grow each and every day in every region across this province. Speaker, Ontario is at a breaking point. And thanks to this government's choices and failure to invest means that things are only going to get worse. Unless there's an initial and an immediate and an urgent investment. What is the Premier going to do to ensure that our hospitals have the support they need to get through this crisis? Do it now. We're at the tipping point. Thank you very much, Mr. Speaker.
Minister of Health.
In fact, Ontario is not in crisis right now. You want to speak about who is in crisis? Have you taken a look at Alberta, where they're doubling up patients in intensive care units? We're not doing that in Ontario. We've made substantive investments. We've made significant increases to hospitals, the biggest increase in a decade. Last year, we've increased the number of beds by over 3,100 beds. We've invested $1 billion for testing, tracing, and contact management. We are flattening this curve. It's Ontario, again. I know it's nothing to brag about, but we're standing at 100 cases per 100,000. Manitoba is 662 per 100,000. Alberta is at 480 per 100,000. Ontario is still the lowest in Canada.